Good health is above wealth. Happy afternoon, everyone. Health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infertility. Today, we have gathered here for seminar on World Antimicrobial Awareness Week 2023 by Fortis Multi-Speciality Hospital, Rajajinagar, Bangalore. Fortis is NAB accredited multi-speciality hospital serving the healthcare needs of the population in and around Rajajinagar for past 15 years. As a part of their community initiative awareness program regarding basic first aid, basic life support, and awareness in short term and long term health issues, nutrition, issues faced by adolescent, girl child, etc., are organized. We are fortunate to have with us Dr. Jyothi, medical head, Fortis Hospital, Rajajinagar from past 10 years. A man would be giving a health talk on the usage of antibiotics and its complication. She has done her MBBS from Ballari Medical College. She has done her MD in microbiology from Dr. B.R. Ambedkar Medical College. She has done her MHA in Mumbai. Welcome, ma'am. I welcome our beloved principal, Dr. Nalini GS ma'am, for the seminar. I also extend my welcome to my colleagues and my dear students. I now invite Dr. Jyothi ma'am to address the gathering.
Good afternoon, students. So today's session, as ma'am has discussed, I want the session to be interactive session. I'll not ask some general knowledge questions. A very much whatever knowledge you have, that we'll discuss. Okay. So I will teach you, but I also want interaction. You can answer whatever you know from your side. Now nobody will feel, nobody will judge you depending on that, right? So please be attentive because I just want to interact more than a classroom session. Okay? Yes. I'm not able to hear that. Yes. Good, students. So today's session, why are we taking on antibiotics? Have you attended such session before? No, right. So actually, this topic is being selected due to a reason, right? Because antibiotic awareness week is going on. If you know, every health day has a day, right? You have a World Diabetes Day, World AIDS Day, Hypertension Day, right? All these days are there. They are celebrated on particular days in a year due to some reasons. Maybe it can be the scientist who wanted to do something on that day, or it would have been an invention, or it can be anything which has fallen on that day. So this week is called as Antimicrobial Awareness Week, which starts from 18th to 23rd of every year. So we celebrate this week so that the general population, youngsters, old people, middle age, all of us should understand that there is something about antibiotics which we should know. Okay? So we'll just start the session first with the definition. What is meaning of antibiotic? Can anybody tell me? Whatever you understand. What are antibiotics? Yes, anybody. Yeah, as I told you, I wanted the session to be little interactive. If anybody can define, it is fine. Yes? Okay. So I think some people are reluctant. So I'll tell you. Okay. So you know organisms. Organisms are something which is harmful to our body. As ma'am was telling in the definition, our health is free of mental, physical, and social. Right? So if we are totally, completely free of all the diseases which are in this form, we are called as healthy. Now, some organisms are present in the atmosphere. It can be a virus, it can be a bacteria, which is not visible to you and me. Right? Between you and me also, there is a air, and in air also something is floating, which is not visible. Why? Why is it not visible? It is a microorganism, which means it is very minute in size, but it has a capacity to destroy a human being. Do you know that? It is so micro, but it can cause a deadly disease in us. And if you see the statistics, microorganism diseases which are caused, even COVID was there. So these diseases which are caused by these microorganisms can be the second most common cause of death. First is always a heart attack. Second one which followed is any infection due to any bacteria, virus or fungus, anything, right? So these are the called as microorganisms, something which is not visible to our eyes, but it is present in air, water, food, and it actually destroys our body in different mechanisms. So we started something called as antibiotics. Anybody knows who was the person who started or who actually discovered first antibiotic? Very good, very good. Alexander Fleming. So he discovered what? Penicillin. Yeah. You will be moving the slides. I can only move here. So the first antibiotic was discovered, which is called as penicillin, okay, by Alexander Fleming. Very good. So Alexander Fleming actually started with penicillin. Then later came so many antibiotics, and now we are in research of multiple antibiotics. There are some antibiotics which can kill many organisms like positive, negative, invisible viruses sometimes. So there are antibiotics which have strength. But initially it was started with only penicillin. So what was penicillin doing? So penicillin was only killing certain group of organisms. So if you know clearly, there are actually two type of organisms. Something called as gram positive and something called as gram negative. So this we define depending on certain chemical properties. Now Alexander Fleming discovered this penicillin. Okay, after which we followed multiple antibiotics. And now penicillin is actually outdated. So we have got different forms of penicillin, which if you go in a hospital, they will write very commonly amoxicillin. Right? So this is the antibiotic which was started. Now these antibiotics are causing infections. Microorganisms are causing infections, and we are giving antibiotics to kill them. Now, anybody who has fever, cold, cough, we usually will diagnose them with what? It can be a lung infection, respiratory tract infection. If somebody has loose motions, vomiting, we can tell it is a stomach infection. Now, if you go to a pharmacy, nearby to a pharmacy, many people have a habit, they don't go to a doctor. They just directly go to a pharmacy. Have you seen that? They go to a pharmacy and tell ನನಗೆ ನಿನ್ನೆಯಿಂದ ತುಂಬಾ ಸುಸ್ತು ಕೆಮ್ಮು ಕಫ and the pharmacist is a doctor, right? He thinks that he can dispense anything. So first thing what they will do is they will give you an antibiotic because they know that antibiotics kill organisms. So they will give left and right antibiotics to you, and your symptoms will come down the next day itself. So what you will feel? You will feel so happy. Oh my God, antibiotic killed. So next time when you get motions, vomiting, you will again go to the same pharmacist, take one antibiotic, consume it nicely, and you feel, oh, this antibiotic is nice. I am free of infection on the second day and third day itself, right? Instead of taking a painkiller or a dolo, paracetamol, you have taken a higher medicine, and now you feel that okay, this works for my body. But what is happening now? See, this is an antibiotic action. So what does antibiotic do? They have multiple actions. I don't want to go into theoretical knowledge. Just see that an antibiotic actually crosses the whole cellular structure of the microorganism, and then it goes and destroy the DNA or RNA, whatever is there in the bacteria or viruses. Okay, very simple knowledge. Just understand that an antibiotic is a stronger medicine which goes inside the organism's cell wall, and then it goes and destroy the organism. So it's very easy for the antibiotic to kill the organism, right? But what is happening now? You took the antibiotic. Now what has happened? You have become slowly, slowly resistant to the antibiotic. What do you mean by resistant? Anybody? Resistant? Opposition. Ah, yeah, opposition is a normal word. Resistant to an antibiotic means, yeah, you have got adjusted. Your body is adjusted to that medicine now. So what will happen the next time? That antibiotic will not help you because the organisms are very intelligent. You know, as the times are passing, they mutate, and they become very clever. So now this organism is very clever, and that organism knows ki if this person takes this antibiotic, I can die. Alright? So now he will change his structure. He'll make his cell wall thin or thick, or he'll make more proteins. So what will happen now? You took the antibiotic second time. Now the organism is very clever. That antibiotic is not going to act on you, right? Now you'll go again to a pharmacist and tell, oh, that is not working. Give me something else. So what will the pharmacist doing? He will again give you a stronger antibiotic. So you started with a basic antibiotic, which is penicillin or something. Now he goes and gives you some other antibiotic like cephalosporins or ceftriaxone. These are some higher antibiotics. Now you consume that and you become all right. Second time infection, you are fine with a higher antibiotic. Next year, you will again fall ill. And now, this is something which is serious. You cannot go to a pharmacy. Now you have to go to hospital because you are falling sick again and again, and these antibiotics are not working. Now you go to a hospital and you show a doctor that I am suffering from cough, cold, fever, and it's not going since 3 days. I have tried all medicines, it's not going. Right? It happens with you? Yes or no? It will happen with you or your parents or grandparents. Somebody will have this issue. So finally you land up going to a doctor. Now the doctor does not know your background history, what and all you have done, testings, trying, experiments. So he will start with basic antibiotic for you. Okay, let me try basic for it. Maybe he'll feel better. You will come again, sir, it's not working. Then the doctor gets to know that you would have tried multiple antibiotics prior. Now he will tell better you get admitted, right? Because now oral tablets are not working for you. Now he wants to give intravenously, which means you need to get admitted. So what is happening now? Because of the resistance which was there, no medicines are working on your body. So doctor is doing trial, right? They are thinking maybe it may help, maybe that may help, or maybe I should take a broad antibiotic which kills most of the organisms. Now like this, it keeps happening and your body gets resistant. That is called as that your body is not getting affected by any tablets. And sometimes people land up in ICU. So in our ICU presently, if you come, there are 10 patients. In the 10 patients, 4 of them are youngsters. 36, 23, 24, 17-year-old boy with loose motions, vomiting, not coming down with any medicines. So this is happening at present scenario, and that's why this topic was very important for you to know that if you keep taking drugs or tablets without any knowledge or without any prescription, then you get accustomed to that medicine, right? So that's why we always tell not to take medicines under or without any supervision. Please do not have the habit of going to a pharmacy and directly asking medicines. If you're asking also, and if the pharmacist is giving you antibiotics, please do not consume it because your body needs these antibiotics. Our future generation needs these antibiotics. If we keep eating like this, our body gets adjusted. So tomorrow you will definitely have a kid, right? You will somehow have 2 3 kids. Your kids will not be actually their body will be resistant to all antibiotics because it has come from you. Understood? So that's why you should save these antibiotics for your future generations. If you keep taking medicines left and right, your body is going to get exhausted. And now scientists also they are going on research. There are some antibiotics which are almost 30,000 to 40,000 rupees. Such a costly antibiotic. Just imagine if a patient gets admitted, because these medicines which are very strong, they are definitely costly also. Just imagine you are admitted to a hospital and your parents turn up ending To give one injection 30,000, 40,000 is the injection charge of the antibiotic. Why is it so costly? Because it is a reserve antibiotic, which means we actually kept only one or two, maybe for something which was very serious. Now everybody is serious. What will be the scientists doing? They do not have that much drugs. Same like COVID vaccines, right? Initially, when we got vaccines, we didn't had so much stocks. So people were ready to pay anything to get vaccinated. So government came into picture. They told no, this is the charge and it should be given to particular age groups. But it's not same with antibiotics. Antibiotics are still under research. So we are still searching what can be affecting to kill these organisms. So that's why make sure that you take these antibiotics only if needed. Otherwise, best thing, sleep at home. Take 2 days rest, third day rest. If not subsiding, only fourth day to a doctor with symptoms that, sir, maybe I'm suffering from something and I need medicines. And the doctor does not start on antibiotics. First day itself, always remember. They always give supportive medicines, followed by which we give antibiotics. Okay. So unfortunately, remember no antibiotic will get rid of your cold. If you're having cold, which is the most common one, right? We all have running nose, cold, and you feel very exhausted. Cold is something which makes you exhausted. You keep sneezing and your eyes are watering, everything, and then you go and your mother tells, okay, take rest, do gargling. So that's the best thing actually what your mother says. Home remedies are the best thing for any minute infection. Your fever is there, take paracetamol, take rest, take water. This is enough for your body. You don't have to take tablets unnecessarily. Remember that antibiotics are not going to cure such infections. So don't land up taking that. Okay. So cold, cough, fever, mild. Please take rest. Have good food, nutritious food. You will come out of that. But instead of that, some people tomorrow I have exam. They are coming to hospital. Tomorrow I have exam, ma'am. Give me something. I want to just become fine. So they will end up taking all two, three tablets they took, slept off nicely. Obviously, all organisms got killed first day itself. So they feel better, they go and write exam. The third day effect of antibiotics will start. What is the effect of antibiotic? They cause nausea, which means vomiting sensation. They cause giddiness sometimes. They cause rashes. You are getting allergic. But the symptoms comes later. So that's why don't land up taking these antibiotics on the first day of any infections. Okay. Now, so yeah, as I told you, there are two words called as resistance. Resistance means once I took that medicine, my body is not reacting. So that is called as resistant. Something is called as sensitive. Opposite of resistant is sensitive. This is not that sensitive that you scolded me and I started crying. That is not that sensitive. This sensitive is the medicine is working for you. Like I gave you a tablet of amoxicillin and your infection comes down, which means you are sensitive to that antibiotic, which means you be very careful and do not take this antibiotic left and right. Keep this antibiotic for the severe infection of your body because your body is actually supporting for that antibiotic. It is sensitive. So remember and do not take this antibiotic unnecessarily. Keep it for last stage or where you feel you need some antibiotic. That time you tell the doctor that, sir, once it happened to me that I took amoxicillin and I was feeling better. So maybe it will be a help to the doctor to start on one antibiotic which is actually sensitive to your body. Understood? So there are two words. Resistant means it's not working out because you are taking multiple times. Sensitive means you have got to know and you keep it with you so that you use it only when you are really sick. Okay. Now, how can we do something to not fall sick? Is it possible that we don't fall sick? Yes or no? Why? It's possible, yeah. Who is that? No, ma'am. It is possible. There are people who do not suffer from any small infections also for 2 to 3 years. They do not get cold, they do not get cough, no fever, no loose motion. There are people who are healthy. Not like you people always having outside food. Yeah, many of you will be having outside food, right? Your students now. You eat at hostel or you eat at home or you eat outside? Tell me. Very home food. Okay. Very, very good students you have, ma'am. They are telling they are having home. So why am I telling that? How can we prevent any infection? Please follow basic protocols. This you will be knowing what I need to tell you very clearly, that when should you do. Now, all during COVID, we all know that we should wash our hands. How many of you really wash your hands? See, some people didn't raise the hands also. So definitely they are not washing it before food. You have to wash hands before food. Please remember. Why? Because you know, there is something with you, all of you have that, even ma'ams have, which has maximum infection. What is it? Huh? No, no, not hands. There is something with all of you, and you, that is the most infective. And you are eating actually with that also sometimes. Huh? Nails. Somebody is telling answer. Phones. Mobile phones. Do you know that our mobile phone, where is my phone? Okay, it's not there. Our mobile phone is the most infected. And many of us, including me, I'm eating one side and I'm taking call other side. But at least I'm using left hand. Many people have habit of eating in between taking phone, in between doing something on mobile. Our mobile is the most infectious part. So make sure you do not use your mobile when you are eating. This thing you should know, because many of our patients who are coming to our hospitals, when we think that what could be the reason, what could be the reason why this person didn't eat outside? He tells at home no infections. Home is very clean. He stays in a good apartment or good home where there is all clean. Where is he getting the infection from? Definitely, it is the source of infection is your mobile. So when you're eating, please wash your hands. Keep your mobile aside. Always remember you should keep your mobile aside and then eat. After eating, you need to wash again. Same is with your restrooms. Once you're going, before also, you need to wash your hands. Many of you do not know that before going to restroom, also you should wash hands. You should wash your hands, use restroom, come back, and then wash hands again. And before and after caring a sick person. Sick person means at your home, you have your grandmother, so you take care of your grandmother because of your loving, affectionate nature. So your grandmother coughs, you keep giving her food, you are near to her. But what you are forgetting is during the coughing, the most harmful organisms get secreted, and you actually tend to take it, or their saris or their dresses, whatever they would have worn, will be actually infected. And you will have a small child at home, so you should make sure that you do barrier. You keep the small child separately from your infected person. So remember, either wash your hands before and after touching your parents or grandparents or anybody who are sick, and keep your children away from them, because children do not know anything. Okay, they are the most what you can say is susceptible people. They can get infected very soon, so you are making sure you do not touch anybody before and after touching them when they are infected. Okay, so these are very important points which you should know for antibiotic usage. And then the next important slide which I want you to know is, take antibiotics only if it is advised, right, by your doctor. Do not think it should be advised by anybody. Show to a medical professional only and start on the antibiotics. Do not buy an antibiotic without a doctor's prescription, okay, which is very important. And do not share your prescriptions or leftover antibiotics with others. Why is it important? Antibiotics, if you know, they all come in a strip. One strip will have 12 tablets or it will have 10 tablets. Why is it like that? Because antibiotics are taken for 3 days or 5 days or 7 days. There's a course, right? Because it's a higher antibiotic, it comes with course. Now, what happens with youngsters or people who do not know about antibiotics? They'll take first day, they'll be totally fit and fine. The second day, do they do not take that antibiotic. They think that I am fine now. Why? It happens with my own family also. They tell, "Arey, you gave me one antibiotic, na? I'm fine. Now I don't want to take no more tablets." It's not like that. Antibiotics, once you start, you need to finish it. Remember, once you start an antibiotic, you need to finish the course. Understood? What is the course? Either 3 days or 5 days or 7 days. It will be given to you by your doctor itself. So you need to finish the course and do not take leftover antibiotics. Leftover means anybody, what is meaning of leftover? Loose ones, cut ones. If you go to any pharmacy and you see, they tell you how many you want and they take a scissor and start cutting and giving you. Do not ever take such antibiotics because antibiotics should be kept at a particular temperature and it should not get uh, more of water, moisture, or air into it. So once you cut it, there are chances and very much chances that the expiry date may get missed if you start taking cut antibiotics. So if any pharmacist is giving you a cut antibiotic or cut medicines, you should avoid it. Okay? So you should take full course and a antibiotic with a proper prescription and complete the course and do not take cut antibiotics and do not share also. Why not sharing? Like I am having cold and cough. For me, somebody started on one antibiotic. My mother also.
I request Asif from Fortis Hospital to give the information of privilege card which is being given to you.
Hi everyone. How was the session today? Somewhere I heard it was not good. How was the session? I can understand. Even I was a part of those last bits. Okay. So you want some more different topics to be spoken in upcoming days? Okay. We will conduct a health talk on different topics. Dr. Jyothi ma'am will be the speaker for those topics also. Okay. Everyone got this privilege card? You'll get, definitely you'll get. We have a lot more. Okay, so this backside of this privilege card, you can see there are certain discounts. Discounts on OPD. What is meant by OPD? Outdoor? No, not outdoor. So it is outpatient department. What what you do if you get fever? You'll go to the clinic and come back. That is called outpatient department. Okay. So if you come to a hospital, you will get certain discounts like 10% discounts and 15% discount on master checkup. All over a body screening will be done. You will get discounts on these things and you have to get this privilege card. Okay, so I know I'm not wasting your time. So okay, fine. If whenever you come to hospital, just bring this card and you show this card, you will get some discounts. There are 5 to 6 discounts. Okay, so you can avail this. Thank you.
Thank you, sir. You can avail your privilege card at the Fortis Hospital. Children, I think you can disperse to your classes.